Pulse oximeter shows the percentage of oxygen concentration in the blood. How to correctly use pulse oximeter? Step by step guide to check the blood oxygen levels of a COVID 19 patient undergoing treatment at home. First, make sure your finger is free of nail polish, false nail, henna, etc. before putting your finger inside the oximeter. Second, warm your hand by rubbing against each other if it's cold. Before taking the measurement, rest for at least 5 minutes. Rest your hand on your chest at heart level and hold it still. Then switch on the oximeter and place it on either of the middle or the index finger. The reading may fluctuate, wait for it to be stable. Keep the oximeter in place for at least a minute or longer if the reading is not stable. Record the highest result once it has not changed for 5 seconds. Start recording from baseline and record 3 times a day at the same time. Make sure that the finger fits well and probe is not too tight, which would constrict the circulation, or too loose, may fall off or let other light in. Do not rely only on a pulse oximeter to assess your health condition or oxygen level. Always call for help early. For better oxygenation at home, the center has also asked COVID 19 patients to lie down on their belly with the support of 4 to 5 pillows. This is known as proning. COVID 19 patients have also been asked to take a 6-minute walk test. Link of both videos in the description box. Ask your question in the comment box and please subscribe to my channel. Thank you.